Proof of concept for a superior therapeutic index of corticosterone compared with hydrocortisone in patients with congenital adrenal hyperplasia by Kyle et al. In CAH, enzyme deficiencies in the HPA pathway cause cortisol deficiency, which in turn causes a hyperactive HPA axis. This results in androgen excess and adverse effects. Current treatment involves supraphysiological doses of glucocorticoids, mainly hydrocortisone, to suppress the HPA axis and androgen release. This is associated with adverse effects such as weight gain and diabetes. This study explores the therapeutic index of a different glucocorticoid called corticosterone, hypothesized to offer better safety in the context of cardiometabolic toxicity. The aim of the study was to evaluate whether corticosterone has a superior therapeutic index to hydrocortisone in adults with 21-hydroxylase deficiency, the most common type of CAH. This was done by assessing efficacy of corticosterone in normalizing markers of disease control and minimizing adverse metabolic side effects in comparison to hydrocortisone. Methods: 13 patients with CAH were recruited to a randomized double-blind placebo-controlled crossover study comparing the effects of 5 hours of corticosterone and hydrocortisone infusions. This was done by measuring standard disease markers and effects on metabolic measurements such as glucose and insulin to evaluate safety. Results: both corticosterone and hydrocortisone reduced markers of disease control compared to placebo. Corticosterone achieved the same level of disease control as hydrocortisone. However, unlike hydrocortisone, corticosterone did not increase circulating glucose and insulin concentrations. Neither form of treatment had an effect on blood pressure or bone health. Both corticosterone and hydrocortisone showed similar efficacy. However, corticosterone did not induce the metabolic side effects like hydrocortisone did. Conclusions: corticosterone acutely controls biochemical markers of androgen excess, similarly to hydrocortisone. It does not induce markers of glucocorticoid toxicity in CAH. The findings establish proof of concept but warrant further clinical trials to validate results over longer treatment durations. To read more, please scan the QR code.